What's going on, guys? It's Dr. Bailey from Dr. Bailey's Evolved Health and Wellness. Let's see if this is up and running. Sorry, it looks like they changed the Facebook Live format a little bit. Um, Today, we got a pretty interesting, kind of broad topic, but I'm going to try to keep it succinct. Um, See what questions you guys have. Hope everybody have a great weekend. Everybody's getting ready for the holiday seasons here. Today, we're going to talk about arthritis. That's kind of a big topic. Also, we're going to talk about low back pain, chronic back pain, those types of things. Um, Now, what is arthritis? What is chronic back pain? What are all these other things? We hear all the time, and I hear it a lot. Degenerative disc disease. How you doing, Miss Lily? Um, Chronic hip and knee pain, hand pain, those kinds of things. And what we're trying to figure out and what we got to look at is where is our pain located? And because that does a lot. You wouldn't think it would, but it really does. You have your primary issues of repetitive usage. So hands, knees, low back, hips. Those are where you're typically going to get what's called primary osteoarthritis. And low back is a big thing for degenerative disc disease and just inflammation, arthritis of the spine. And they can be mutually exclusive if you needed to. Um, Now, when you start developing arthritis in other joints, elbows, shoulders, ankles, those are not the typical what we consider primary areas for osteoarthritis. Those would be more of a secondary issue. And a lot of times when we have secondary osteoarthritis, and incidentally enough, there's another issue at play. There's some other contributing factor. Marfan syndrome is a big one. I mean, there's a bunch that come into to the mindset there, and it should be going through your doctor's head. I mean, sometimes we as doctors, we're humans and we kind of get in a rut and kind of get in a day-to-day routine, and we don't really dig into why are things happening or why are you having pain in this issue in this area, and then it allows us to kind of go on from there. So when we're talking about arthritis, what is it? So arthritis is basically the breakdown of the bone tissue in the joint area. You have cartilage that's there to protect it. Over time, we break that cartilage down. There are some people that have some genetic risk factors that cause them to break it down a little bit more prematurely. But then once that cartilage is not in that space anymore, you got impact and wear and tear on the actual bone tissue itself. Now, cartilage doesn't have nerves, so cartilage doesn't hurt. Um, but going forward, what you do is you lose that cushioning and then you start to get impact on bone, and then bone is where we get our pain from. Now, medication wise, for years and years and years and years, it's always been anti-inflammatories. It's ibuprofen, it's meloxicam, it's diclofenac. Interesting enough, though, we do know that those cause problems. We know that it causes kidney issues. We know it causes gut issues. You get ulcers, and especially my veteran population, I think everybody can kind of relate. I'll never forget, I walked into my medical setup in Afghanistan, into the pharmacy there with my medics, and we had these huge jugs. And I wish I had something that was close to it, but they were literally like the industrial mayonnaise jugs, and they were up on the pharmacy shelf, and I'm sitting there looking at it. I was like, what's in there? They didn't have a label, so they opened it up. It was 800 milligrams of ibuprofen tabs, because that's what we pretty much gave to everybody. So we just didn't have a lot of options there. You can't really give a controlled substance in a war zone. So what what we have seen though, and I was actually surprised with this. So good, bad, or indifferent, whether you talk about doctors that are board reviewed and board certified, and that's a whole nother discussion for the cannabis industry especially. Something I really like to do is try to keep up with what's going on. I mean, that's how you keep up with medicine, because medicine's constantly changing. Cannabis is a prime example of what's happening with medicine and the research that's going to be done. But going through newest Mayo Clinic board review, because eventually I'm going to have to redo all that. And I was really interested to see that it actually didn't talk about anti-inflammatory, or it did, but as a second or third or fourth line treatment. They're talking about Tylenol first. Now, even Tylenol has its own problems. Tylenol has, it can hurt your liver. It definitely has an issue there. Tylenol is actually better on the liver, incidentally, in somebody with hepatitis or cirrhosis than ibuprofen, just less than 2 grams a day. I know a lot of people get concerned and scared of Tylenol whenever they have liver issues and disorders, but it's actually better, like I said, at 2 grams or less. But even our textbooks now are saying, hey, anti-inflammatory is probably not the best route, right? So then we start looking, okay, what routes can we go? And obviously, if you've been following the page, you know who I am. I'm really big on holistic medicine. I'm really big on cannabis. I'm really big on giving the body what it needs. There are a lot of times that we can. How you doing, Mr. Early? Hey, and then Mr. Cottrell as well. Um, I'm really big on trying to say, hey, can we treat this stuff without, and the med shed folks as well. Make sure y'all share this video out for me. But what you'll see is that with cannabis, you've got a lot of opportunities for treatment there. Now, this is going to kind of segue back into my talk 2 weeks ago, where I talked about some of my vets and my patients that were starting to develop paranoia and anxiety from high THC levels. Well, what we're seeing is, yes, you do have to have, THCV is a great compound. THC Delta 8 is actually a good compound, but we're really going to focus on CBD primarily when it comes to inflammation and pain relief. Now, a good 1-to-1 ratio in a low dose is great. When we start looking at trying to get some of that entourage effect, we definitely want that because we know that the nerves being fired up in that area of the joint and inflammation and pain, definitely going to calm down with some THC environment or THC added to that environment. And then CBD will help with the cytokine production as well as inflammation in that joint space, help decrease synovial fluid production, the swelling that comes along with injuries. And I say that with the prime example. So October 24th, blew my knee out, tore my ACL, strained my MCL, and tore my posterior meniscus, or posterior horn of my anterior meniscus. So I'm going to be having reconstructive surgery on my knee January 6th. And with that, what we see is that I'm gonna try to monitor and show. We're working on a topical formulation of cannabis product, incidentally, which will should work really well in a joint space like that. But really focus on something that's obviously not going to have a lot of Delta 9. Don't really care about it, but it's going to have THCV, hopefully a good combination of that with CBD to try to get some anti-inflammatory benefits there. Hold on, let's see here. Yeah, Miss Early, yeah. I fought at 145 pounds October 24th. Right now I weigh about 180, 185. That is the difference. Let's see here. All right, everybody's got all caught up on the comments. So um now, and CBG's out there. Don't get me wrong, but CBG does have what we think a little bit of analgesic component there. It's actually really at the forefront of antibacterial components with CBG. That'll be kind of neat to see as we progress through that as well. Let's see here. Then we start talking about, and I'll get into some strains here in just a minute, but because they really do follow that whole paradigm. But then we can start talking about terps. Terps are real hit or miss. And from what I've seen in testing in Oklahoma, again, super pisses me off. I really wish we had more universal coverage there. Mr. Early likes his CBG. Yes, sir. Actually, some of the products we made have a high potency CBG in there. So my biggest terp right now, caryophyllene and humulene. I mean, those two together are powerhouses. Now they can be kind of relaxing, obviously, so that's kind of something you want to look at. Eucalyptol, linalool, terpineol, and valencine is another one. Almost all of those, and I'll list them off again, but are very anti-inflammatory. And so we're going to do a great job in combination ICBD. When I say low THC, I'm talking, most of the strains I pulled looked like they were in like that 8 to 12% range. Nothing super crazy high. But again, it is going to change whether you're looking at concentrates or flower or edibles. But so caryophyllene, eucalyptol, humulene, linalool, terpineol, and valencine were my big ones. From looking at strains and looking at combinations and look at what's being used. Let's see here. Now, strain recommendations. That's going to be a little bit tough depending on, flower versus concentrates and whatnot. But ACDC, Canatonic, Girl Scout cookies, and Harlequin. All done exceptionally well. No matter where you go across the web, you're going to find at least a couple of those in the recommendations for inflammation and arthritis. Big believer in that higher CBD. I mean, we see so much benefit there, and it's just because of what we know. Now, if we can get into some higher level THCs without THC Delta 9, that is going to profoundly drop your risk and concern of having paranoia and panic and all the other things. I mean, I'm seeing about 45, 50-ish patients a day right now, and if 30 of them are renewals, and I ask them, okay, hey, anything new medically? Okay, anything negative when it comes to the cannabis program? The number one thing across the board. Well, I have to kind of play with it to figure out what kind of made me anxious and whatnot. So again, the trying to in the military we call it mitigation, risk mitigation. Risk factor mitigation is my big thing right now going into the summer for our big military training. Same thing with cannabis, same thing with life, right? You just try to look at it and say, hey, how can I mitigate or lower my negative risks or whatnot there. So big things again, which joints are infected or affected, and then how do we treat it. And textbook, I was actually, again, I was surprised. The first thing it talked about was joint mobility and exercising in ways that offload that joint. That's what I'm struggling with right now. Necessarily talking about my weight. I can lift some weights, but because of the way I tore my knee, they won't really let me do anything. I can ride a bike. That's it. And so until I get that repair done, I'm just kind of limited. And so with that, we talk about joint straightening, strengthening. And anytime you have a joint, incidentally, it needs to be repaired, whether it's a hip, whether it's a knee, whether it's an elbow or a shoulder or whatever it may be. Increasing the muscular strength around that joint will massively shorten your recovery period and make you get back to full functionality faster. So it talked about that and it talked about weight loss. And weight loss is big. If you've been around me long enough, and if you watch the videos, or if you've had an appointment with me, you know it's something I really, really stress and push on, especially in Oklahoma, Arkansas, Midwest United States right now. You know, if we take, and I probably said this on previous videos, and I apologize, there'll be times I do that. But if we take the average individual and we stand them straight up, and if we point through the back of them out right where their pain is, if they have low back pain, and we point out of it, 99% of the time it comes out of our belly button. And it's something that if we can really focus on trying to cut down and decrease that area of tissue. Now you can't say, listen, I want to lose just the fat tissue right here. You can't do that. Body didn't work that way. But if we can do some different things, and right now COVID sucks. Everybody knows it sucks. It's frustrating. You can't get out. You can't do stuff. You're really limited. I know I was up at like 5 o'clock this morning, we have a trash program in where I live in Broken Arrow and a recycling program. So you got to have the trash cans out a certain way and a certain time. And I'm out cutting cardboard up at 5 o'clock in the morning, make sure it goes in the recycling bin. And, um, and I'm like, man, I need to go run, but it's cold and the gyms are all closed. Well, not closed, but it's real hard to get out and get into the gyms. So yeah, definitely something that's there. Really got to look at your caloric restriction. I know that's no fun, but you definitely do. And so my goal with these is try to say, hey, how can we avoid surgery? We know that the success rate in lumbar surgery. Now, this is not every case is individual, but we know that the success rate of a lumbar discectomy and all of that stuff, or degenerative disc repair, is like it's like 45 to 60%. Was the last numbers that I pulled. And I need to refresh that. It's been about 18 months, but they're not great. Part of it is because of the number of muscles that are affected when they cut through. Part of it is it's going to hurt. And when we hurt, as human beings, we just don't want to move around a lot. It's one of those issues that if we can avoid it, we definitely want to try. And I don't know if I have, since I lost my Facebook way back yonder. I don't know if I have a picture or not of my wreck, but I was in a real bad wreck May 18, 2017. Um, and I rolled my truck 200 yards. I blew out my L3, let's see, L3, L4, L4, L5, and L5S1. And when I did that, there went 6 months where when I would try to brush my teeth, I had to put my elbows on the sink, and it was miserable. It hurt all the time, and that's why when I try to tell folks, I try to tell y'all to do what I've done, and I'm not ever going to be too good to say that I'm going to tell you to do something that I don't do personally. So I'm really focused on trying to make sure that I strengthen my core. I did the injections, I did the physical therapy for goodness. I did it for 16 weeks, goal directed. I was the patient. I showed up on time. I went home and did the stretches they told me to do. Didn't work. Still hurt. And being the athlete and doing those things, I was frustrated because that's my stress relief. That's how I get out. That's how I deal with all the stress that I throw on myself is exercise. And so started doing core strengthening, started really looking at diet, and started really looking at how do I focus and increase that strength in that area. Made all the difference in the world. And as Mr. Early and some of the folks tell you, when I was fighting last, in October and training for that fight, I mean, I've gotten back to where I walk around about 175, 180 pounds typically, and I can squat almost 400 pounds again. But it's not anything other than good form, and then working on those little things that I didn't really think I needed until I needed it. Posture, core strength, core strength, core strength, not sit ups, not crunches. Um, as far as did I use anything for pain? I will admit, Miss Jane, I was a bad one. I was a big ibuprofen user. I used it way too much. Did it work? Yeah, it did. It probably torched my kidneys a little bit too. I know that I had a lot of lab work because I went to Afghanistan the next year and had some medical issues, lost my vision in Afghanistan and got most of it back, that type of deal. And when I came home, I had to have routine labs and stuff. And I know my kidney function wasn't the best, still not bad, but not the best for my age range and health status. So I suspect it was probably from ibuprofen use. And then topicals. I don't think I have a couple CBD topicals. And that's another thing we start talking about cannabis. Well, at the time, Ms. Jane, I was still kind of learning about all this. Yeah, I realized that was 2017. And I didn't start doing my recovery until the fall of 2017. It wasn't really until the winter time and in early 2018, actually, when I was sitting in Afghanistan, that I was studying up and trying to figure out what 788 was, what cannabis was going to be, what CBD was. Um, and even though there's no ways to test for it, the military still actually had this discussion this weekend at a big medical readiness event with the 45th in Norman. I was down there this weekend, and we were discussing CBD in the military, and the Senate actually just approved it. Now, my big discussion, and I laughed whenever somebody brought that up. I was like, well, listen, how you can't test for it anyway. So I mean, how are you going to know if soldiers using it? But anyway, neither here nor there. That's why I didn't really use a whole lot of CBD. I didn't start using CBD until probably the summer of 2018. And then I've been using it ever since. I really wish I could show you my office bathroom little closet there, because I've got several different varieties and types from producers all over Oklahoma. I won't use anything from outside of Oklahoma just because I'd like to support Oklahoma, and I like to kind of know where stuff came from. So yeah, it's definitely a big help for me. Now, for me, from a CBD perspective, from the inflammation point, it does help. The CBD infused topicals do a great job. Biofreeze, there you go. Actually, we're working on hopefully a combination product that's similar to Biofreeze, but CBD and THC infused. My goal is to come up with something for this for our soldiers, for our police officers, for other folks that may otherwise not be able to have use cannabis products and still get some good relief there. Hopefully, we've got some processors that we're sitting and talking with, and hopefully we'll be able to come up with that for situations just like this. So. All right, let's see here. Any questions, guys? Feel free to drop a comment, questions, concerns, anything that you guys got. I'm all about trying to, I want these to be beneficial. I want you guys to be able to get something out of it. I want you to feel like when you got done listening to me ramble for 20, 25 minutes, that it was worthwhile. Also, I'm the worst at topics. Because I start thinking way off into depth. So if there's a topic that you guys are curious about, and it doesn't have to be cannabis related, I can always work cannabis into there. If it's something that needs to be, you want to talk about even blood pressure, I've done blood pressure, but if you want to talk about it in general, let me know. If you just have a general medical issue that you want me to discuss, I'll be glad to go over it. I was actually talking with a patient this morning about that, because so many times we go in to see a doc and they give us a diagnosis. We don't know what the hell they just said. But when somebody asks you what medical problems you got, you're like, well, I got this. That's what doctor tells me. What is that? I don't know. And so I feel like by doing this, my goal is to just give advice. And it's not direct. I'm not giving you direct medical care. I mean, we'll set up an appointment for that. But I can do a lot with just general advice and almost like a teaching aspect if it's something you want to know about. And I can tell you one thing that's been positive from COVID. The one one thing is the fact that it's forced everyone to look at their general health. I mean, not only because the gym's closing down, but what subset of the population is COVID really hammering on? Not just the autoimmune, not just the people with weakened immune systems. It's more along the lines of cardiovascular disease, diabetes, overweight, COPD, and cigarette smoking. Those are four huge things that we can work on pretty easily without a gym, without medications most of the time. Sometimes we need it. But it's just a knowledge, it's just having that knowledge. Just sharing quick as best treatment with cannabis for arthritis and pain. So it's going to depend on the forms you're talking about. So I listed some strains earlier. ACDC was a good one. So I wrote down Canatonic, Girl Scout cookies, Harlequin, all great strains for cannabis that are or for flower that are going to give you some pretty significant pain relief because of, like I said, they're in that typically like 8 to 12% THC range, but you're also getting a real high CBD content. Most of them are actually almost a 1-to-1 in their ratios just because of the fact that they're lower THC, but you can get some pretty profound pain relief. Some of the more potent topicals are going to do a great job as well, meaning looking for something that's got a high CBD content in a topical formulation. I really like THCV. I think there's going to be a lot of research that's going on with THCV and will help kind of progress as far as what we know and getting that focal pain relief. Now, when you're talking about, Ms. Quick, when you're talking about arthritis and pain, you also got to look at what joints are affected. Hands, elbows, knees, shoulders, hips. My big one's just wear and tear for me is hips and knees, and especially after just I'm on a low back after my wreck, but having surgery on my knee coming up, that'll be something I really focus on with a topical as well because you can get good absorption there. Now, if you start talking transdermal is going to give you a lot deeper, but it's going to give you a systemic release as well. And so, like for someone like me, I can't use transdermals yet because of the military. But we're probably not far off from that. But yeah, at least right now, I can't do anything along those lines. Let's see. Make sure I got these questions. Boom, boom, boom. All right, again, guys, like I said, feel free to share this out. The more people that we can get this shared out to, the better. Again, it doesn't matter if I wrote the rec or not. Doesn't that's not even the preface here. The whole point is just try to get information out and help as many people as we can, which is general medical problems. Because right now, that's what we're looking at. If we could a healthier society, COVID isn't going to do anything. I mean, it's just the way it is. I was real fortunate. I had COVID for I mean, I was sick. I say sick, body aches and super bad fatigue and headaches for about 30 hours, and that's it. Let's see. So patient has a complex regional pain syndrome, some relief without feeling high. That's difficult, Ms. Acklin. And so, hey, Ms. K. So CRPS. CRPS is a really bad pain disorder. We don't understand 100% what comes from because sometimes it's triggered after a surgery. A lot of times it's triggered after a surgery. Sometimes it's triggered after a viral illness. It's like fibro on steroids, but it only usually affects one area. Now, in order that is going to be tough, exactly, because in order to treat that, it's probably going to be something along the lines. It has to have some form of THC in it, mainly because CBD doesn't bind the nerves. Now, it does great for inflammation and pain. Do not get me wrong, but if you have a nerve symptom, which is almost all CRPS is nerve activation and overactivation of that nerve, it's a issue of you're going to have some THC there. So this again, this is my gripe against dispensaries that don't have really solid testing, and not even so much dispensaries right now, but the labs that aren't giving us good reproducible testing results. If we can look at something higher in THCV, higher in delta 8 in THC in general, Avoiding delta 9. Delta 9 is going to give him the head high, and that's what we're trying to avoid. We can still get nerve activation or decrease nerve activation with THC. You're still going to get a good CBD anti-inflammatory response. But that's an issue that it will take some trial and error on a Saturday or Sunday when he doesn't have a lot of plans, and just kind of play with this. Too many people are afraid to play with it. That's the beauty of it. You know, with cannabis, what you can do is you try something, you take it home, try it, then you'd be willing to go back to that dispensary the next day, the next week, and the next month and be like, listen, I tried this. Show them the label. Show them a picture of the label. Show them a product. I don't care. Let them know, hey, I tried this. I got this response. And then for your patient, for your father there, Miss Ackland, I would say something along the lines of, you know, he's trying to treat this nerve pain and he got a little bit of a response, but got too much of a head high. And then the hallmark of a good bud tender and dispensary person or worker should be able to look at that and be like, okay, we responded really well to this, that, or the other, according to the label, whatever it was that they tried. All right, let's see here. Problem with not being able to use any cannabis products without them putting me to sleep, even just a small amount. So, Miss Robbins, having a lot of issue with, I would assume, couch lock or just a serious relaxation. You may be one of those people that I know I'm typically pretty anti-sativa on these videos, but you may be somebody that responds really well to a sativa dominant hybrid. It's going to depend on what you're looking at from a perspective of when are you trying to treat and what are you trying to treat, and then what products are you comfortable using. That'll make a big deal. And that is something that's one of my gripes. I love the fact that we got a lot of docs doing Rex right now, but that is one of my gripes. We've got to do a better job as physicians writing recommendations, educating our patients on this exact topic. When they come in to do the renewals, they need to kind of go over, hey, how are we getting this? What are we getting out of it? All right, sensory processing disorder develop tics like Tourette's. Okay, so Miss Jane, there is a video I did, and I'll probably revisit it on autism and the spectrum disorders. But one of the big issues, and the reason I brought that up, I know you didn't type anything about autism here, but sensory processing, we know that sensory processing is a big deal with the spectrums, especially the spectrum disorders. And I'll try to feed back into that, maybe do like an update in the near future. And I'll probably start doing next. I think we're about 30 videos deep. And not that we're ever going to run out of medical issues, but again, there's certain ones that are just more relevant to the Midwest, to the area, and going through those again, just kind of revisit them, try to be more to the point with each one. Because again, I mean, what we do is I go back and look at these videos and see when people are watching. I know how I start talking too long, people start to tune off, and that's fine. But at the end of the day, I want it to be beneficial, and I want everybody to get as much out of it as possible. Uh, Cannabis journals, yes. Mitch was talking about that. One big thing I've been talking about to all my patients: keep a journal. I know it's old school, and you can do it on your cell phone. There's a couple apps that you can get. I think the Relief app will allow patients to journal their strains and what they got out of it, and testing and all that. But if you really start to do that, especially initially, every single new patient I talk to, I tell them to do this. Get a journal and then write down what it is you tried, write down the testing, the terp profiles, all the information you can get from it, and then what was their result? How did they feel about it? And what that does, that gives you tons of power, because if you walk into another dispensary, and so for my folks that are in Arkansas, which is real big, because Arkansas has like 20 dispensaries in the entire state. And so if you leave to go to a different dispensary, say you're out visiting family, friends, or whatever, the likelihood of that dispensary having the same selection of what the previous dispensary had is almost non-existent, especially since there's a statewide shortage in Arkansas. But by knowing what you respond to testing wise, endocannabinoid wise, terpene wise, and that gives you all the power. And when you walk into any dispensary in the world and say, hey, what do you have with, high caryophyllene content or high THCV content or high CBG, you know what I mean? You can start going through there, or CBN for sleep. I mean, and it gives you that power. Right. Man, Sammy Kilgo is asking about replacing replacing opiates with cannabis. Yes, you absolutely can. Now, one of the things that I talk about when I talk about pain, and I did a 2 week long segment on pain and cannabis a month ago or something like that. It was like a part one and a part two. Kind of went over how pain works and how cannabis treats pain and some terps and all those different things. So that's something that you absolutely can. And I've had patients come off of fentanyl patches and super high doses of pain meds. And then I've had some patients that have been able to decrease their opiates by 50%, and that's kind of my goal. Typically, whenever I see a renewal patient, I'm real big on, hey, have we had to start any new medications? If we have, why? And then B, which incidentally, usually why is because we're getting off into high sativa, really strong sativas, and we weren't getting pain relief, we were getting anxiety or something like that. And then on the flip side of it, um, what what new meds and what new medical conditions are we getting benefit? And by especially in Oklahoma, when you can grow and the purchase quantities are so big, there's a lot of really cool things that you can do with this, whether making your own topicals, making your own edibles, cooking with the oils, having flour. I mean, the opportunities are endless there. But again, what it's going to come down to is, hey, what did I respond to really well to? And then you can magnify that out, especially if you learn to grow at home. I mean, that's a lot of people don't understand that gives you so much power by having that here in Oklahoma. It's what makes a huge part of what makes our program as awesome as it is. Let's see. Severe arthritis in the spine, best thing for my pain. All right, Miss Glenda Hill Forest has severe arthritis pain associated with the spine. So again, you're going to have to look at what are you hoping to use? Are you hoping to use flour? Are you looking at concentrates, looking at edibles? What are you looking at? And then from there, it's really a matter of again, low THC variety. Everything that I've come across for the big strains, there was four big university in about 15 different websites. I pulled four different journals, and everything I pulled recommended the same couple different varieties. ACDC, Canatonic, Girl Scout cookies, and Harlequin. Now, almost all of them are going to be typically a low THC variety, and there's a couple different reasons for that. But what we're looking for is we're looking for THC to help with the nerves, to calm down the nerves, the inflammation in the bone itself. A lot of people don't realize disc and cartilage don't really have any nerve involvement. It's the bone around there that has nerve involvement. That's where you get your pain from. Or in the spine, what happens is you get erosion or breakdown of the bone, then you get impingement on the nerves, then you start having issues from that standpoint. So ACDC, Canatonic, Girl Scout cookies, Harlequin, very easy to find at least one of those, probably all of them in your local dispensaries. Caryophyllene, humulene, those are my two big terps. I love those. Eucalyptol, linalool, terpineol, and valencine were all big anti-inflammatory terps. Incidentally, on the Evolve page, we have a folder, and we're going to go through and we're trying to organize those now. Terp Talk, and so we've gone through and taken all of our terpene posts and put them together, so that you can kind of see what each one may do, benefits you can probably get from each one, and combinations, and which ones are more typically sativa dominant, indica dominant, those kinds of things. All right. And a topical. I tell everybody, man, topicals do not get the love that they need. You throw an edible or flower down and then directly apply a topical. I mean, literally, you're getting the best of every world possible, and you're attacking that pain from multiple different angles. All right. Let's see here. I think. Oh, Miss Jane, I miss you. Can we see previous videos? Yes. If you go to the Evolve Facebook page, and then across the top, I believe it should say photos, videos, or more. If there's a more tab, click there. It'll drop down, show all the videos, and you can just scroll down. And I apologize. I didn't do a great job of doing the topics on all of them, or the title on all of them, especially once Facebook kind of changed up the setup here. But you can listen to the first 90 seconds, and I kind of go over, hey, what our topic is for that day, and it'll get you pretty quick on where we're going to go with that. All right, let's see here. Make sure I'm not missing any of these. All right, guys. I talked a really long time. I hope you guys got something out of it. I hope everybody has a very Merry Christmas. I am. Let's see here. I know I've got the Christmas lights and running. My house is kind of like National Lampoon's. I'm not gonna lie. I'll probably post a picture of it before long. But if you guys need anything at all, again, shoot me a message through the Evolve Facebook page. I'm trying to keep up with all the comments and show up on the videos here and everywhere else that get posted. But the biggest thing is make sure focus on this primary video because that comes straight to my phone. Started with fentanyl, hate opiates, and like condition. If he's going to a wheelchair. Yeah. All right. Yeah, Miss Amy, message the Facebook page, and I will see what I can do. We'll kind of go over everything, go over your history, and see what we can recommend. I mean, I'm sure we'll get you. We can get you a card and get you up and going, and then kind of get you some guidance on how I would proceed if I had your issues, or I would have my family members proceed. Okay. All right, guys, let's see here. So, just real quick, we will have next Monday is we'll have Medical Monday then, and then the 21st we will cancel. I'm going out of town for Christmas, so I either leave the week before Christmas, leave after Christmas. But this year's week before Christmas, so I'll be gone the 21st to the 25th. Also answer the Facebook messages. You guys have any questions, problems, or concerns? I will definitely get back with you guys pretty quick. And then from there, we'll get back on it the 28th. So we will talk to you guys all next week. I hope you guys had a great weekend. Hope you guys have an awesome week, and we'll talk to you later.